So we are really fortunate. Recently, we acquired the Crisalix imaging morphine system. And by morphine, I mean we're able to simulate the results of a surgery in order to give a patient an idea of what we might be able to achieve. Now, that's a really important thing for rhinoplasty because patients with rhinoplasty, perhaps more than anything, come with a generally with a really well fixed idea of what they would like to achieve, but it's very difficult to articulate, to explain that to a surgeon. And it's really important to get a great result that a patient be able to communicate to the surgeon what they would like to achieve, for a patient to be able, for the surgeon to be able to understand what the patient desires and to have a conversation in that shared visual space. To be able to have a patient say, I want this, and the surgeon say, oh, that's wonderful, I think we can do that. And a patient to then say, well, I want this also. And a surgeon say, well, I could do maybe about half of that, and really come to a mutual understanding of what is reasonable, what's achievable, so that a patient can leave a consultation and head into surgery with realistic expectations. Only when that occurs can a patient then be happy with a result. They have to understand what to expect. And a tool such as Crisalix is very helpful with that. We use this in conjunction with a patient's inspirational photos. So we often ask them to bring with them photos of noses, whether they've had surgery or not, that they like, either from popular media or something they find on my website or even someone else's website. And in the past, I used to use Photoshop, and Photoshop works really well. The challenge with Photoshop, though, is that it's not three-dimensional. So I could only show a front view and a side view. With Crisalix, we can do a three-dimensional view. So this is Amy. She is our wonderful medical assistant. She's got a lovely face, and she's got a really nice nose, but like many people, there were some changes she wanted to make in her nose. And so I'm going to kind of run through the simulation that we did with her. You have to bear with me. There'll be some things that I do and undo, and that's really part of the process. It's good for a patient to see you kind of thinking through what's needed. So without further ado, I'm going to go ahead and do the morph. Now, one of the things that Amy and I talked about is the fact that she has somewhat irregular or non-parallel dorsal aesthetic lines. So the dorsal aesthetic line imperfections that might exist afterwards. So they have really realistic expectations. So let's start morphing this nose. So first of all, I'm going to narrow the upper part of her nose, the upper third of her nose, with this part of with the module. So we're narrowing that part. Then, this might seem a little unusual, but I'm actually going to widen the central portion of the nose because it's a little bit narrow relative to the lower part of the nose. And so you can see I'm widening that just a little bit there. I'm going to narrow that upper part a little bit more to help create some balance. And you can see that we're starting to get those dorsal aesthetic lines to be at least a little bit more parallel, a little bit less divergent. And again, we can see that it leaves behind a little bit of the imperfection, but that's really kind of good, again, for a patient to see and accept. Now, her nose is a little bit off to her right-hand side. Again, her right-hand side. And so I'm going to shift that a little bit over to the left. So I shifted just a little bit to the left. And then the tip as well is a little bit off center. So we're going to shift that as well. You can see, kind of shift that a little bit there. Okay, now let's take a look at the tip width. That's one thing that we're going to narrow a little bit here. So we're going to narrow the tip width some. All right, we don't want to do too much, but that's kind of consistent with what the patient's desires were. And then we're going to bring in the nostril or the ala just a little bit. And just a little bit here, just a little bit. I think the tip could benefit, again, from just a little bit more narrowing without making it look pinched. Now, we're going to look at the nose from the side, and this is where we can think about the fact that she has a very subtle dorsal convexity, or a very subtle dorsal hump. So we're going to reduce that a little bit. And this is a really good one to kind of show a patient, hey, we can't overdo it, but I think that's reasonable, especially if you combine it with bringing the tip back just a little bit, which we're going to do also. And then just a very slight rotation of the tip. And this I may do and then undo. And again, this is good for a patient and for me to sort of explore what makes sense. Okay, So let's take a look at that, make sure we're happy with it. Look at that from the front, very nice. From the side, let's kind of look at it from all sides. Okay, I think it may benefit from just a hint more of that. All right, now we're going to go ahead and X out of that. And then I want to do the comparison view. So let's first take a look. That's our morphed nose. And what's wonderful is you can really see it from below and then from above. And then we're going to stop there for just 1 second. Okay, and so now what we have here is on the right of the screen, we have the patient's before, and we have the sort of projected afterwards, what we think the after may look like. And so we can take a look. Here's a really great image where we can kind of see that the nose is a little bit smaller, a little bit less projecting, tip is a little bit less projecting, ever so slightly rotated. We can kind of turn up just a little bit. And that we have a really nice straight dorsum with a very subtle supratip break, and with the tip sticking out just a little bit more than the dorsum. You can see it's a very subtle change, but really creates a whole different appearance to the nose. One that she felt was very favorable. And then as we slowly rotate, we can see that we have a narrower tip, that the dorsal aesthetic lines are a little bit more regular, a little bit less narrow in the middle. And then again, the tip is better defined, a little bit smaller without being pinched. So again, an overall really nice result. I think that it's kind of good because it shows that there can still be some minor imperfections, but generally if a patient looks at this and they say, you know what, I see that, but I really like the overall changes, that means that's going to be a successful surgery with a very happy patient.